Yeah, EMT paramedic or fire paramedic.
Jack, do you need any more information from me? Yeah. Okay. Karen, can you hear Pastor Chuck? No, ma'am, no, sir. Okay, but you want her to go? Huh? We're ready, so we can be on time. Michelle, okay, I have questions. I have a couple, how long the vaccines. I want to talk about the booster. Do you have anything? We're going to play off of you, too, a lot.
Okay.
Because you have more information.
I know, she's always.
Oh, thank you. Thank you. I really had a really casual shirt on. And then I said, Dr. Nicole's coming in here looking all cute. And so I changed to this shirt, and it's hot. And so then I'm like, I could have kept my blouse on. Because I had said, I just want to be really casual today. We're in the living room. So Michelle's going to go on to the Loveland Facebook Live thing. She can answer questions. And then she'll let us know. Okay, I'm ready. Do I need to tell Karen anything? Karen's in the different room. Okay, fine. There's several production rooms upstairs. We're ready. That's your camera right there. That's mine. That camera right there is the wide shot of both of us. Living room. I'm Charlene Singleton, and come on in. We're going to have a good talk like we do. We talk about life from the living room. There's no bad questions. There's no wrong questions. Every question will get some kind of answer, whether today or another day. So today I am so thrilled to have our guest, Dr. Nicole Sims. Praise God.
Pastor.
Hi. Okay. And Dr. Sims was with us a few months ago. And Dr. Sims, first of all, once again, welcome.
Thank you so much for having me and welcoming me back. I appreciate it.
We got so many comments from you. I had people telling me, well, I haven't really trusted a lot of doctors, but I trust her. Okay, it was one of our highest rated shows also.
Praise God.
So thank you, and I know you've been working, you went to work at 6:30 this morning.
Yes.
And it is now almost 6:30 again.
Yes.
So Michelle and I both are just so grateful to you coming. So Dr. Sims is the Chief of Hospital Medicine at Community Hospital in San Bernardino, where all four of my sons were born. She is also the Associate Chief of Hospital Medicine at St. Bernardine's Hospital in San Bernardino. And so, once again, we have someone that I personally am proud of because she looks like she just graduated from high school.
Thank you so much.
And yet and still she has all this experience. And she came in her scrubs, which
Yes, I'm so sorry that I look like this. I want to look like you, Pastor.
If I had your degrees, I'd be happy. I just want to look like you, okay? And so anyhow, no, I'm so glad you came in your scrubs. Dr. N. Sims, what's that say?
DO.
DO, Internal Medicine. What's that stand for?
Doctor of Osteopathic Medicine. So I went to DO school, and we get extra training in spinal manipulation and osteopathic medicine. So,
wow. She just said something that some of you understand, and I understand a little bit. So, Dr. Sims, we wanted to have you on again because there's a lot of hesitancy with the vaccine right now. Still, should people get it? Should they not? What are some of the issues with it? A lot of my friends and people that are just associates, some of the hesitancy that they have is how quick the vaccine came out. But I remember what you had said last time, that after the first trial, they have to stop and go raise a lot of money. And then after the second trial, they have to go and raise some more money. But with the vaccine, because of the situation with COVID, the government was funding them, so they didn't have to take all that extra time.
right.
So I've told people, no, if you have money, they could come out with the vaccine at quick. But another question that has come from that is, well, the first vaccine, I believe, was given in January, and now this is August. So they haven't had enough time in many people's minds to see what I don't know how you say it, to see
The efficiency, the side effect profile,
and all of that. So can you just give them an answer?
Those are all valid questions, and I just want to remind you that just because it was done in a small amount of time doesn't mean that it was rushed along. Just imagine if you were building a house and you had $1 million. It wouldn't take you a year to build the house, because you had all the resources that you needed. You had everything that you need to buy the resources, and you could hire as many people as you wanted to, so you could get a house up in a week, if you had enough people, enough money, And so that's kind of what happened here. We were in a pandemic worldwide where people were dying, by the hundreds of thousands. And so we had to step in and do something. And so there was a sense of urgency and really getting something to help people really survive this. So we don't have a lack of subjects. We have a lot of people with COVID, and we have learned a lot about the virus. The COVID virus that we talked about last time, the family of coronaviruses are not new to us. We know a lot about coronaviruses. This strain of COVID-19 is something new. It's kind of like if you have a family of dogs. You know a lot about dogs, but you may not know a lot about pit bulls, right?
Exactly.
So you can extrapolate or kind of transfer some of that information on what this dog will act like as well.
Right.
And so that's kind of how we understand how COVID works. And a lot of people have gotten vaccinated. There have been clinical trials that have been done. A lot of people are enrolling in clinical trials. And so we have a lot of information. And it's not just in the United States. That's not the only place that's happening. In the UK and the Netherlands, there are a lot of places that are doing clinical trials that have information in South America, South Africa, that are doing clinical trials to get information. So I think that a lot of people are kind of weary because you only hear about what's happening in the United States, but this is something that's happening globally, and people are putting their heads together to kind of figure out, how do we stop this pandemic?
I'm so glad you said that, because I never thought about that. So different doctors and scientists in different parts of the world are actually powwowing together.
Yes.
And just sharing their data with each other to come up with the best solution.
Yeah, I read a study from the Netherlands that they were doing with pregnant women, and we'll talk about that a little bit later. There's a lot of stuff that is coming from the UK, a lot of, journals and articles that they have done over there. So there's a lot of information out there, and we're just trying to piece together kind of, what is the best way to go with this, and also interpreting it correctly.
That is awesome. So I know you spoke at the International Women's Department a couple of days ago. Tell us a little bit of what you talked to them about.
So it was.
And let me interrupt you because I'm actually going to be texting a couple of my friends that they need to turn this on to listen to you. So I'm not ignoring you. Okay.
So we were actually talking about, we talked a little bit about COVID and stuff like that, but mostly it was the International Department of Women for the Church of God in Christ, and we were talking about silent killers and undetectable illness. And one of the things I talked about is mental health, and really we as African Americans really don't focus a lot on our mental health, but what we've seen with COVID and the pandemic is that mental health is so important. The suicide rate in African Americans has gone up, substance abuse. So those are kind of some of the things that we talked about mostly. I think, a lot of people are tired of COVID. No one's more tired of COVID than healthcare workers, let me tell you. But, with the Delta variant, it's really changing the game, honestly.
Tell us about that. How is it changing the game?
So the Delta variant, what we know about viruses in general is that they're able to mutate, and their only job is to survive. And the way that they survive is by changing themselves to be more adaptable to whatever situation that they're in, right? And so that's why you get sometimes antibiotic resistance, because the bacteria learns, how to thrive in that antibiotic. Okay. So what's happened with COVID is that there are changes on the spike protein, and that it can affect the cell more easily, this Delta variant. Mm-hmm. It can affect the cell more easily. So instead of before, let's say, it took 2 keys to open the door to get into a cell in the body. And I'm oversimplifying it.
I want you to oversimplify. Yeah.
But now the Delta variant, it takes 1 key, opens the lock, and it's in your cell. They're saying that the Delta variant can gain access to the cell within 10 minutes. So within 10 minutes, it's gone from your wherever it was in the atmosphere to your nasal passages to your cells, infect the cells, and then telling your cell, start making more of me. And then it spreads out to the rest of the body. 10 minutes. With COVID, with the Alpha, which is the original COVID strain that we have, they were saying more like 15, 20, 30 minutes or so. So that means that this virus is more transmissible, more contagious, if you will. It's easier to spread between people, and people get sicker faster.
That's a question that I personally have then. I was watching TV yesterday, and it said something like there were like 2,300 new cases of the Delta variant, but then it said in 39 deaths. So it seems like, and correct me if I'm wrong, it seems like this Delta variant is way more contagious, but not as deadly?
We don't really know. We're not seeing deaths like we were in the original pandemic, for sure.
Okay.
And so that is a good thing, but we are seeing more cases than we were seeing daily. We're kind of going up that ladder. So there is some idea that the death rate may not be as high as the Alpha variant. However, we are seeing people with severe symptoms of COVID, and their recovery time is a lot longer. So, there's this whole thing about long haulers.
That's exactly where I was going. The long haul, the long haulers.
So what long haulers syndrome is that after you recover from COVID, you have long-lasting damage to organs in your body. Mm-hmm. One of the things that we see, people have hardening and scarring in the lungs, so it looks like they've been a smoker for 30 years and they're only 30 years old,
Wow.
So there was a lady, I think we were talking about, there was a runner. She was an athlete. She ran marathons and things like that, and after she recovered from COVID, she was on oxygen. She could barely get out of her bed without, getting short of breath. And those are the things that we're seeing. There's there are symptoms like COVID mind fog, where
Yes.
people can't remember how to do simple math problems. They just feel like their mind is in a fog. They can't. It's in a cloud, and they can't concentrate. People that have severe fatigue, people that have continued muscle aches, people that ended up on dialysis and their kidneys never recover. And so we know that yes, even though you may recover from COVID, and the chance of recovery is well, you may have long-lasting symptoms.
Okay, and that's a good, that was a great answer. I really appreciate that, because that is one of the things that I watch this all the time. I was actually showing my husband the other day. I'm like, wait a minute, look at all these people that got this Delta variant, but look at the deaths. But with COVID, it was like all these people were dying, but that's the question came up.
Yeah.
But even though they might not be dying, the quality of their life
May not be the same.
may not be the same.
And another thing is, we don't know how people will do. We don't know if you get COVID, will you be okay? Will you not survive? We're seeing now in my hospital, we have most of our COVIDs are under the age of 50 years old.
Okay, and that's a change.
And that's a change. Before it was, 80 and older,
Right.
their chance of survival is less than 25%.
Okay.
So now we're not seeing a lot of elderly people with COVID. One, because a lot of them have gotten vaccinated.
Most of them. Yeah.
And then the second reason is, well, that's the main reason. And now we're seeing the younger population, the people that haven't been vaccinated.
Okay, so now, and that's a whole, seriously,
Yeah.
that's like a whole can of worms with the younger people. So let's talk about masks for a second.
Sure.
Okay, so talk to us about masks.
So masking is important. Masking is important because what we know about the Delta variant is whether you're vaccinated or unvaccinated, there is still a chance for spreading the virus.
Okay.
Okay. And this comes up the question, people are like, well, why should I get vaccinated? If I could still
That's the question.
spread the
Yeah.
virus. So a couple of things. How this works is there was a study of healthcare workers that were vaccinated and that were unvaccinated.
Yeah.
And they looked at the viral load versus the vaccinated and the unvaccinated.
Mm-hmm.
And the viral load was about the same, okay, between the vaccinated and the unvaccinated until day 6. After day 6, if you're vaccinated, your viral load decreases dramatically.
Okay, I gotta stop you for a second. Everybody might not understand what viral load is.
So viral load is the amount of virus or viral particles that are in your body. So when they do a swab, they, isolate the swab, they look at the viral particles, and they get a number based on that.
Okay, so now you can finish. Okay.
So until day 6, and then the vaccinated people, the viral load decreases dramatically.
Okay.
And so that lets us know that the vaccine works. It works in decreasing your rate of transmissible.
Yeah,
The way that you can spread it.
Okay.
It decreases your viral load, and so you're less contagious. You're less likely to spread the virus. So that also brings in the fact that we still need to wear our masks, whether you're vaccinated or unvaccinated, because in that 6-day period, you can still spread viral particles. Now, what they didn't look at in that study were these particles active particles,
Okay.
or were they just dead viral particles?
Right. Okay.
So, you could test positive for COVID and have mild symptoms or no symptoms at all, and maybe what they're picking up are dead viral particles because when you test for COVID, the only thing that they look at is for COVID PCR, they look for COVID, DNA, COVID particles.
Okay.
And they can't tell if they're dead or if they're alive or anything like that. So
Okay.
that's why people that may have COVID may test positive for many weeks after. Because when you're swabbing, you're picking up the COVID particles, and they may be dead particles. And that's why we say after 10 days that people are not infectious, because we know that those particles, they're just shedding dead viral particles.
Oh. See,
So we really don't
Yeah.
we really don't know if the vaccinated people are really contagious. But there is the idea that they could still spread viral particles. We don't know if those viral particles are dead or alive. So as a safety measure, we should all be wearing masks, whether you're vaccinated or unvaccinated. We should wear your mask, especially if you're unvaccinated.
Okay, so this is a question that has come up because we knew you were coming on the show, so I have had different people asking me
Sure.
questions. Okay. So someone says everybody, and I do agree, everybody should put their mask on. But when it comes down to children in schools, okay, the children with the mask, and I'm not necessarily even asking medical. You could do medical or you can do personal an answer to this. But the question that I personally have this question as far as children wearing masks in school. The reasoning for children wearing masks, even though children do not get COVID and like the older people do, was because they could now take it home and spread it.
So let's back up.
Okay.
Children can get COVID.
Right,
You
okay.
know, in Texas and Mississippi, I mean, they were running out of NICU beds. They were running out of pediatric ICU beds because children were getting COVID and they were getting very, very sick. So we know that children can get COVID. We didn't see so much with the Alpha variant, but with Delta variant, for whatever reason, probably because it's a little bit more prevalent, or I'm not a pediatrician, so we are seeing more kids with COVID. And also, too, we're testing more. Before, we weren't really testing kids because we didn't really think that kids can get it.
Right.
So children can get COVID. They can get COVID.
But the percentage seems like it's a smaller percentage than.
Yeah, I don't really know about the percentage. I know that that in states that have low vaccination rate, the rate of children getting COVID is higher.
Okay.
But what that translates into death and complications,
We don't.
I don't really know.
Okay, so with that question, this was a conversation that some of us had the other day. Okay, so the rationale still came down to a child taking it home and then infecting their grandmother or their parents with it. So the answer that one person had for that, and I'm like, that is an interesting thing. Well, anybody can get the vaccine right now. I mean, there's no standing in lines. You can go to the grocery store and get a vaccine right now. I walked in Target the other day. Actually, you can get a vaccine any place right now. You know, you can go to McDonald's probably and get
Right. Just drive through, get your hamburger,
get your hamburger, your vaccine. Okay. Anyhow, so because anybody can get this, if somebody chooses not to get the vaccine, knowing the dangers, if a person doesn't want their child to wear a mask, and like I said, I think everybody should wear a mask, and somebody says, well, your child could go home and spread it to somebody that's unvaccinated, well, that's their choice, that they did not get vaccinated. So I personally have
except that they're going to a public place with other people, right? And so school, right? Kids are going to school with other children. So you can choose not to get your child vaccinated. But what about they're in a communal situation with other children that may have low immune systems? They may have other medical problems. So then should those kids not go to school? Because, you know what I mean? So we have to do what's best to protect the masses. And it is a personal decision. And I think that, you know, unfortunately, this vaccine has gotten so much bad press and, you know, so much political, you know, this and that. And it's really unfortunate because, you know, a lot of people died that didn't have to. But it's a personal choice, and you have to assess your own risk and make a personal decision for yourself. But that doesn't mean that the school can't impose rules to protect the masses of people that are there.
No, I think everybody should wear a mask. That's just me. I think everybody should. I heard yesterday on one of the news channels that some studies had come out about the emotional danger it was causing to little kids, like 6, 7, 8, to have to wear a mask because they were afraid of dying. And that's just, I don't have an answer for that. It's just something that I'm just heard
Yeah,
yesterday.
I mean, there are things that we all have to do for safety measures, right? We have to wear seat belts if we're going to drive in a car, right? If there are things that we have to do to protect ourselves and to protect other people. One of the things that they looked at is, the physiologic response of kids seeing their loved ones in a hospital, their parents in a hospital, or their mom not coming home because she died of COVID,
Yeah.
or, you know what I mean? And so I think that we have to look at kind of
The greater good.
the greater good, and yes,
Yeah.
and I think that this pandemic, and we should talk about this mental health. We'll have to do a mental health. This
Okay.
pandemic has affected people in so many ways. Things that we never, that we took for granted. Kids not being in school and how that affects them psychologically, emotionally. And, we just never looked at those kinds of things. And I think that it's important. And I think one thing that COVID taught us is to really pay attention to mental health and the mental health of our children.
Right, because just in ministry, so many more separations, so many more divorces, so many more suicides. I mean, this has really affected us. Michelle and I did a segment on, we either did mental health or we were saying we were going to do mental health.
Yeah.
I'm talking to my co-host, Michelle, who loves to be behind the scenes. And so, by the way, if you have some questions and you want to Facebook those questions in, Facebook them to the Loveland, and Dr. Nicole will answer your questions. Okay, how long do the vaccines work?
So what we're seeing is probably, we were thinking, when I say we, the medical community.
Right, we know that.
6 months to a year, but now we're seeing a little bit more breakthrough cases. And I think that, people are concerned about the breakthrough cases because they're like, why should I get the COVID vaccine if I can still get COVID? But what we're seeing is the number of breakthrough cases in comparison to new cases are trivial. I mean, they're really a minute number of cases. But because that's what you see on the news.
Jesse Jackson, who is a personal friend of
Yes,
Pastor
and his
Tuck
wife,
I,
right?
and Jackie, Jesse and Jackie, both of them vaccinated. Jesse went on TV.
Yeah.
And got that
I think he got vaccinated early on, right?
Yeah, he got vaccinated way back in January.
Yeah, January. And that's what we're seeing. We're seeing that a lot of the breakthrough cases are people that have gotten vaccinated early on in COVID. And so that's why they're talking about booster vaccines and booster shots and things like that. But what we are seeing in the breakthrough cases is that most people have mild cases and they're not ending up on the ventilator, they're not ending up in ICU, they're not ending up in the hospital. Jesse Jackson may be the exception to the rule.
But I don't think
he's in the hospital though, right? But not
Yeah, they weren't. It seems like they were mild cases.
And unfortunately, because the media sensationalizes.
Well, that's what we hear.
Yeah, a lot, and that's all you hear. So then you're like, oh, everybody that got the vaccine, they're still getting COVID.
Why? Yeah.
And
if I got the vaccine already, and am I going to have to get this booster for the rest of my life?
Yeah.
Is it going to be like even the flu? It's just once a year you have to get the booster.
Right. Well, vaccines. What we know about the COVID vaccine, and I think they overestimated the time that it would really have
in the first place.
In the first place, I think 6 months was probably a good time frame. And now that we're looking at all the data, 6 months probably should have been the time frame. And honestly, what we should have done is given the first vaccine, waited 6 months and given the second one. But, we were in such a pandemic that we wanted to give people the maximum amount of immunity and protection that we could in a short amount of time. That's why they made it a 2 to 3 week.
Right. So is that something that's coming down the pipeline, that get the vaccine and then 6 months later get the other, or is that just something that you in your
That's just something that I read in the medical community that, probably, if we ever get out of this pandemic, that will be something that
could be looked at down the line.
Mm-hmm.
Okay, we have a lot of people, Dr. Nicole, that are just really hesitant about getting the vaccine. So I know you've addressed this a little bit, but can you just make them comfortable? The reason I'm asking this of you is because, like I said, I've talked to a lot of people, and I've heard over and over, well, that doctor that you had on before, I trust her. She's like the only person I trust. And I've actually had people tell me, well, I don't know if I'm going to get it, but if I was going to get it, it would be because of what you said. And so people trust you already. Yeah.
So, I have strong feelings about getting the vaccine and getting vaccinated. I think that,
And that's fine, because that's
Yeah.
what we're on, not for just your medical, but your personal.
what we do know about COVID is that it is affecting Black and brown people at an alarming rate, more than our Caucasian counterparts. 100% sure. The risk factors for COVID: high blood pressure, high blood pressure, diabetes, and obesity. Can you think of anybody that has all three of those?
Yeah.
We all can, right? I mean, we all know someone that has diabetes,
Yeah.
high blood pressure, maybe a little thick in the thighs. You know what I mean?
Yeah, exactly. And a couple other things. Yeah.
And that makes those people at risk. And because those things are prevalent in our community, we are more at risk for having severe, moderate disease.
Okay.
And so I think that, you know, when we look at people that have been vaccinated, it's our Caucasian counterparts. They're getting vaccinated no matter what they say. I think I read something about 80% of Republican senators and governors are vaccinated. So no matter what they say about the vaccine, they're getting it.
Because see, now if you just listen to the news, you think, well, you have all these people, and this is not political, but all these
Yes.
Trump supporters that we don't want this vaccine and they're not getting the vaccine. And I haven't even heard that statistic that you just now said.
I think like 80% of doctors have gotten the vaccine.
Okay.
And so, you know, we as healthcare professionals, we're getting vaccinated. And one, because our risk is higher, but, you know, if we thought that it was something dangerous, why would we get vaccinated?
That's a good answer.
And we are the people that you need to help you get better.
Wait a minute. Even outside of that, why would a healthcare person that knows that they can get exposed drink some poison? Because you're going to be concerned about you first. Obviously, you should be. Okay. And so, no, that's a great answer.
And I would also say, too, that, you know, for people that think that, you know, this is a conspiracy theory, that, you know, the government is trying to put microchips in our arms, and, you know, there's these things on Facebook where people put a magnet or something on their arm, or it's just not true. This is a global pandemic, right? These vaccines are given globally. There are people in India begging for vaccines, and here in America we're like, whatever, you know. This extends beyond the United States of America. And I think we're so like egotistical sometimes in the way that we think. Everything's not about us. The government is not trying to poison us in the United States. They don't, because this is going worldwide. So then, you know, how much sense does that make that our United States government is trying to poison the whole world? Like, it just doesn't make a lot of sense when you, and I also encourage people, when you know, read these things on Facebook and on, you know, YouTube and TikTok and all those social media things, just be careful with the information that you read. Track it down and see. A lot of times I look at a lot of conspiracy theory stuff because I just want to know what people saying and like how, you know, they kind of got off the wrong track. And when I track down the information and where it came from, it always leads me to something political.
Okay.
It always does. If you track down something far enough, it always ends up on the left or the right, someplace like that.
And that's why a lot of people don't trust this, because we see so much fighting in Washington, the Republicans and Democrats. And even if a Democrat wants to do something, maybe a Republican say, even if they both want it, if this one suggested and this one says, this one knows, oh, that's going to help them get reelected, we're going to have to go against. There's so much suspicion with Washington, so anything that's coming out of Washington seems that way, seems to cause more suspicion and more hesitancy. This is what I will say to people, though, because I just had a girl yesterday tell me, well, she thinks that this is about the mark of the beast, et cetera, and the tribulation. And I specifically told her, no, this is not the tribulation. There's a whole lot of stuff. You can just look at the Bible that has to take place before we get to that place. Okay, now.
Read your Bibles. Read your Bibles.
Now, with that, howsoever, I do believe that, my personal belief, that there are some shadows here, or maybe even a dry run, as to how the Antichrist will come. And this is why I'm saying this. It's not a conspiracy thing. This is like this. When the government right now, or even different places of employment, tell people you have to get a vaccine, there are some that feels like that's overreach only if they are. I just counseled a girl today, and she was like, I am willing to get tested every day if that's what it takes to make my job feel comfortable for me not to get the vaccine. Personally, if somebody's willing to get tested every day as opposed to the vaccine, I think that should be a choice. Now, I'm curious to know, and I don't even know if some of the stuff you can say out loud. Okay.
Yeah, I mean, these are all my opinions. This does not represent the company that I work for or any,
right.
you know. I want to point out one thing because people really get this confused. The government is not making vaccines, right? Scientists, doctors, epidemiologists are making the vaccines. So it's not like, Governor such and such is back there stirring it up. And the government is not making vaccines. Doctors are making vaccines. And these are safe vaccines. What the government is trying to do is stop people from dying and getting sick because it affects the economy. There's other reasons that they,
it's a rippling effect.
I think that people have the right to make decisions for themselves, but there may be consequences for those decisions. When I went to Africa, I went on a missions trip. I had to get
them shots we had to give.
I had to get vaccinated for yellow fever, for malaria, for
there's like 4 or 5 shots
I
had to get
all
when I
kind
went
of
over
stuff,
there.
hepatitis booster, all those kinds of things. And if I wanted to go, that's what I had to do.
That's good.
And so it's the same with vaccines. I think healthcare workers, I feel strongly that all healthcare workers, if you work in a hospital, you need to get vaccinated. We have a right and responsibility to protect ourselves and our patients. We went in healthcare with the notion that we're going to help people, and I think that it's our responsibility, it's our moral responsibility to get vaccinated and to protect our
I know. I'm loving you. I'm loving because this is what I'm wanting. I'm wanting you to just kind of let's talk, people.
Let's talk because the truth of the matter is, all of the patients that are in the nursing home that got COVID, it wasn't from being outside and doing whatever. It's from people that were working there that gave those people COVID-19. So we have a responsibility. We have a moral responsibility at an oath. We took an oath to do no harm to people as doctors and even as nurses. There's a nurse oath, I'm not sure what it is, but that we have to do the right thing for and protect the people that we're taking care of. And so, a lot of nurses are up in arms because a lot of hospitals are requiring that you get vaccinated. And, I think that there are people that may have medical exemptions, religious exemptions we can talk about later, medical exemptions and things like that may not be appropriate for the vaccine. But I think that that's the minority. I don't think that that's the majority. Yeah. And
I agree.
I think that, an employer has the right to say what they want to happen in their place of employment. And your choice may be that you don't get the vaccine, but maybe you can't work there. And so that is a consequence for that action. If I want to, drive without a seatbelt and I get into a crash, or if I get pulled over, I'm going to get a ticket.
Yeah. No, these are awesome answers. I mean, seriously, they are awesome, but I wanted the Nicole to come out. Yeah.
I know she came out. Dr. Sims came out. So
I
Nicole
want Dr.
is
Sims
back.
to come out. Yeah. I want Dr. Sims to come out. And so, like I said, let me clarify what I was saying a minute ago so people don't run with that. All I was saying is, as far as that dry run, right now we have employers and different people, different groups of cases and different employers that are saying you either have to get this vaccine to work here or you can't. But then you might have somebody that's, I'm not going to qualify for another job. And so I was saying that if I was going to be here for thousands and thousands of years, I would look at that and I was like, okay, well, that's one way we can get people to get this mark. This is not that time yet. There's a lot of years. Read your Bible. There's a lot that has to take place before Jesus comes back, before the tribulation takes place. There's a lot of years. This is not it. But I do believe that this is a shadow. And so I do, once again, I think people should get people should wear their mask. And I don't have I tell everybody, get the vaccine, okay? Wear your mask, get the vaccine. I just said it on the show the other day. To me, there's still a more of a higher, I don't know if I agree with somebody having to get a vaccine if they're willing to get tested every day. That way, but now from a medical point of view, I think you just said though, that somebody could, let's say nobody's requiring every day. Some companies are saying you have to get tested twice a week or get the vaccine. But from what you said earlier, somebody could get COVID and the day after they got tested and now they're not getting tested for 3 more, they can be fine. Get tested,